As Canadians return to what appears to be a new normal following the peak of the pandemic, recent comments by the WHO chief remind us that the global health emergency is not over. On Monday, the head of the World Health Organization said there is no doubt that we're in a far better situation now than we were a year ago. But Director General Tedros Adhanom Ghebreyesus says COVID-19 remains a global health emergency. Now, that's despite an expert panel saying that the pandemic may be nearing a phase where higher levels of immunity can lower virus-related deaths. He's hoping that in the coming year, the world will transition to a new phase in which we reduce hospitalizations and deaths to the lowest possible level. Well, joining us now to give us more insight into the pandemic in Canada in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great to be here.
So where is Canada at when it comes to the severity of the pandemic, Dr. Raut?
Well, Canada is doing well comparatively. We have about 81% of our entire population vaccinated with 2 shots. Overall, every province is reporting a vaccination rate greater than 75%. And many of us are actually quite cautiously optimistic that even the new variant, which is the XBB.1.5, also known as Kraken, is actually not going to be as severe as we thought. We initially thought that it would cause reinfections in people and cause a cascade of cases that typically we would have seen in December, January of last year. But so far, the vaccinations and our immunity has been pretty effective in keeping our COVID cases and deaths low.
Sounds like some good news, Dr. Raut. Now, going back to what Dr. Ghebreyesus was pointing to, the 170,000 people who died around the world in connection to COVID, this was in the last 8 weeks. What do we know so far about the demographics associated with these deaths?
Yeah, so we certainly have seen surges in certain weeks of COVID-19 in a few other countries. As an example, we know that a study done by Peking University showed a significant amount of increased cases in China in the past few weeks as well. And what we saw in that model was that hospital in big cities where healthcare facilities are better and more easily accessible were crowded with COVID-19 patients. But I think the issue there was also the rural areas. So many elderly, sick, and disabled in the countryside are being left behind in terms of COVID treatment, and those do build up in the number of deaths that we are seeing just across the world as well.
So how many severe cases and deaths have we been seeing in Canada within this time period?
Right. So if we look at just our time period, let's say even in the last week or so, we've seen around 11,000 cases across the country and around 229 deaths, which is not in keeping what we would have seen as a trending average as well. So we haven't seen these huge increases as some other countries have.
All right, Dr. Raut. Now, as we say, we're in this new normal amid these severely reduced restrictions. How important is it for Canadians to still take these precautions to protect from COVID? And what would this look like within this new normalcy that we're living in?
Right. So I think as physicians, this is a very classical question we get with our patients, not just for COVID, but for anything. So if you have high blood pressure and you're put on a medication, the blood pressure is good. The question is, do I really need the pill? And the answer is yes, we still need these precautions here. The precautions we're taking have been very helpful in keeping our cases at bay, but it's still important that we continue these precautions. Now, what exactly are these general precautions? It's just making sure that you're getting your vaccines and boosters, staying away from others when you feel sick, and wearing a mask when you're vulnerable, or if you're going to be around vulnerable people. So basic precautions that are very helpful here.
All right, basic precautions, Dr. Raut. About a minute left here, but last year we talked a lot about the rise of other viruses that we saw in Canada, like RSV and the common flu. So where are we at when it comes to the risk associated with these viruses?
Okay, so maybe some more good news there, but cautiously. What we have seen is that when we look at the cases of RSV and we look at the influenza cases, we're seeing levels that we would expect pre-pandemically. We're not seeing these massive surges as yet. Now, granted, with a lot of mask wearing that we did in the past few years, the surge is definitely higher than what we saw in previous years, but certainly not pre-pandemically. So as long as we're able to maintain these levels, I think we're going to be okay.
All right, Dr. Raut, a quick 30 seconds left here, but if you could leave us with one message regarding safety in 2023, what would it be?
Okay, I think the social cost of sickness is really incalculable, and the prevention is, for the most part, the most important. So education is key. Vaccinate when you can, test when you can, and wear a mask when you can.
Dr. Raut, always great having you on Forum Daily. Thanks again for your time today.
Thanks so much for having me.